continent of Africa, and we held him at the airport for 11 hours. Then we put him in a cell. Then we put him right back on a plane home. Now, he had the right visa. He had the dream of his life, and we sent him back anyway. So we have agents for that, right? But the country the team is coming from is fighting a virus with no vaccine and no cure, and a scientist whose entire job it was to stop it before it ever reached the stadium. We fired them. So I'm Dr. Ida Brown in New York.
And I'm Dr. Sonia Sloan in Houston, where this whole thing is now about to go down in my backyard.
And we are AYA,
Black and Brown Women Disruptors in Healthcare and Beyond, and apparently America First. I mean, that includes the airport, right, Dr. Brown?
So we're not here as pundits today. We are here as physicians because...
Did you just hear that? A referee, the best in Africa, held for 11 hours, put in a cell, then put on a plane home. He had the right visa. He did nothing wrong. And in the same breath, the scientist whose job it was to stop Ebola from reaching a packed World Cup stadium, fired. That is not an accident. That is a policy choice. The 2026 FIFA World Cup starts right now. Millions of people from around the world are landing on U.S. soil, including travelers from the Democratic Republic of Congo, where a new Ebola strain is spreading, a strain with no licensed vaccine.
Show you exactly how the pieces connect.
Yeah, so let's start with what actually is happening, because the fear traveling is faster than the facts right now. So we need to go through what those facts exactly are. There's an Ebola outbreak in the Dominican Republic of Congo and Uganda, and it's called the Bundibugyo strain. And so this is the 17th Ebola outbreak in the Congo it's faced in years. And so here's what makes this one more frightening to us as physicians and doctors. Most of the Ebola strains now have vaccines. However, the Bundibugyo does not have a licensed vaccine and no approved treatment plan right now. So what saves lives in early support care right now and really catching it fast, so monitoring and testing.
And so, Dr. Sloan, catching it fast is the whole ball game, right? So in medicine, we say the same thing in the trauma bay that public health says in terms of an outbreak. Timing is everything. Timing is everything. So you find it early, you isolate it, you trace the contents, and then you contain it where it starts. So again, you find it early, you isolate it, you trace the contacts, and you contain it where it starts. But Dr. Sloan,
landing on U.S. soil, including travelers from the Democratic Republic of Congo, where a new Ebola strain is spreading, a strain with no licensed vaccine, no approved treatment, and the people whose entire career was built to stop that virus from getting on a plane. Gone.by the end of this video, you will understand exactly how this happened, who ordered it, how much it cost, and what it means for every American sitting in those stadiums or watching at home. Stay with us, because no one else is connecting these dots for you. 4 steps: find it, isolate it, trace it, contain it. Those 4 words have saved millions of lives in every outbreak for decades. Doctors learn them in medical school, public health teams drill them every year. And here is what they are not telling you on the evening news. Right now, the United States cannot execute those 4 steps, not because we don't know how, not because the science is too hard, because we fired the people who do it. This is the Bundibugyo strain of Ebola, unlike older strains, the ones we beat in 2014 and 2018. This one has no licensed vaccine. There is no approved treatment protocol. That means early detection is everything. You miss it once and you are already behind. Here is what makes this moment uniquely dangerous. Houston, Dulles, and Atlanta are the only 3 airports in this entire country where travelers from the outbreak zone are being screened. 3 airports for the whole country, and a CDC office.
U.S. aid operations like these used to help trace and treat past Ebola epidemics in Africa. Now, health workers say they've been left blind after the Trump administration pulled U.S. funding.
I think the U.S. funding cuts certainly contributed to the late understanding of the current situation and is part of the reason why we're so behind in responding now.
CBS News medical correspondent Dr. Celine Gounder worked in West Africa during the Ebola crisis a dozen years ago. She says the funding cuts would have been felt immediately.
Once you don't have money, once the money runs out, you can't be ordering supplies from various different sources. You can't be paying salaries.
Meanwhile, aid groups in the Congo are working with local communities, opening treatment centers like this new 60-bed facility built by the World Health Organization. The first suspected Ebola case was 40 days ago.
Why did it take so long?
This Ebola type is a rare one. The test kit people used was optimized for the Zaire type and not for the Bundibijo type.
Right. So, we're playing catch up, right? So let's just talk about what we tore down, because there is, this is where it stops being a foreign story, right? This is thinking of disease surveillance as a detective squad. And the people whose job it is to spot an outbreak early anywhere in the world and stop it before it gets on a plane, right? We had the best squad on earth. And in 18 months, we dismissed it.
Yeah, so
Sir is supposed to meet every single one of those travelers, ask the right questions, and flag the right cases. But since January of 2024, the CDC has lost more than 4,300 workers. That is a quarter to a third of the entire agency. Cut, gone. What this actually means for you is simple. The person sitting in that screening chair right now is exhausted, understaffed, and they are the last line of defense between a case in Congo and a case in your city. This is not fear-mongering. This is math. You cannot do this job with a skeleton crew. And right now, as the entire world lands in America, that is exactly what we have. Look at this chart. This is what dismantling public health looks like in numbers. Before 2025, over 21,000 people working at the CDC, career scientists, epidemiologists, people who spent 30 years learning how to stop a virus in its tracks. By mid-2025 more than 4,300 gone. And the cuts hit the exact teams that handle infectious disease, measles, Ebola, flu, the teams that protect you. The chair where the CDC director sits, empty. No director, no principal deputy, no chief of staff, no chief medical officer, every leadership seat vacant. This is what they chose to defund. Remember that? I want you to sit with what you just heard. Health workers in Congo said they were left blind. That is a direct quote. Blind, because U.S. funding disappeared overnight. U.S. aid was not just a foreign aid agency. It was America's early warning system. It was the team on the ground in the villages, in the clinics finding out.
very same door, right? But it's a skeleton crew reading questionnaires, right? And they tell you exactly what our government really has decided was the threat. And it's not a virus. Unfortunately, it's our visitors. And here's the lineage we cannot skip. In 1974, the same Congolese team, then known as Zaire, was the first team from the sub-Saharan Africa on this stage in America. And a whole generation of pride now has been tainted, Dr. Brown.
52 years later, they come back to a World Cup, and the country hosting them built a wall of agents at the front door and gutted the doctors at the side door. So history keeps teaching us who gets treated as expendable: Black, brown, African, immigrant, the body. Never the system. There are no detectives on this case because we decided the case was the people, not the pathogen, not the disease.
Breaks before they spread, before they got on a plane. And I believe this next part is the most important thing in this entire video. This is not what happened to foreign countries. This is what happened to us. Because every dollar we spent tracking Ebola in Congo was a dollar protecting Cincinnati and Kansas City and Houston. Here is what they chose to cut. $647 million from global health security before this outbreak ever started. Then only after people were already dying, they announced $23 million for the response, $23 million after the fact, after the cuts, after the firings. Every American should know this. They found $2 billion by shutting U.S. aid down, and they found $23 million for the emergency after it was too late to matter. This is outrageous because the math is backwards. Prevention is always cheaper than response. A dollar spent tracking a virus in Africa saves $1,000 and countless lives when it stays in Africa. We had the best disease detective squad on Earth, and in 18 months we fired it. The former officials who built that system said it plainly. The epidemiologists, the virologists, the people trained for exactly this moment, they are no longer there. Elections have consequences. This right here is what they look like in an outbreak. This map tells the whole story. The red zone on the left, that is the active Ebola outbreak in the Democratic Republic of Congo. And Uganda, a new strain, no vaccine, no approved treatment, still spreading. Now look at the right side, 3 airports in the United States: Houston, Dulles in Washington, Atlanta. Those are the only doors. Every traveler from that outbreak zone is supposed to come through one of those 3 airports, where a fully trained, fully rested CDC officer is supposed to catch any case that slipped through. But here is what nobody is showing. You on the same screen.
So replace the fear with some facts every single time. You know, a virus does not need a passport. It does not care what country you are from, what team you love, or whether the agent.
Those 3 airports on the public health side of the door are running with skeleton crews, the immigration enforcement side. Fully staffed, fully funded, aggressive, same door, completely different priorities. And when you see this map and you understand that we fired the disease detectives, you understand that we are not prepared. Not because we can't be, because someone chose not to be. That choice has a name, and it has consequences. Same door, the immigration. Agent is funded, fully staffed, ready, the public health screener, running on fumes, understaffed, and not even getting paid on time. That tells you everything about what this administration decided was the real threat. It was not the virus. It was the visitor, and I want to be very clear about what we just watched. This is not a mistake. And when the outbreak hit, they found $23 million late, wrong amount, wrong timing. Meanwhile, they had agents, holding cells, and enforcement lanes, fully staffed to detain a referee for 11 hours. A man with the right visa, a man who just wanted to do his job at the World Cup. Here is what I believe, and I say this as someone watching your government make these choices in real time. When you defund the disease detectives, you do not save money. You spend it later in hospitals, in emergency rooms. In the chaos of an outbreak, you were too understaffed to catch early. We saw this in 2020, and in 2020, the career scientists were still in their chairs. The guardrails were still in place. Even in the chaos, they held the line. Those guardrails are gone now. The chairs are empty, and the whole world is landing in Houston. So here is what you do. Get your vaccines. Current measles is surging right now in this country. Call your representative. Tell them to rebuild the disease workforce before the next outbreak, not after. And be the calm, informed voice in your circle. You cannot catch Ebola from the seat next to you. The empty lab is the danger, not the family waving the flag. A virus does not need a passport. It does not care who got let through the door. It only asks one question. Is anyone still watching right now? The honest answer is no, but we are. And so are you. If this video opened your eyes, hit that subscribe button right now. Because this story is just getting started, and I cover it every single day. Don't miss what's coming next.
अंधेरी दीवारों में खुद को ढूंढता हूँ मैं गए जो दिन सहाने थे उन्हीं को सोचता हूँ मैं तुम्हारे बिन ये मौसम भी बड़ा बेसर्द लगता है दिल का हर एक कोना अब बहुत ही दूर भरता है अंधेरी दीवारों में खुद को ढूंढता हूँ मैं ये जो दिन सुहाने थे उन्हीं को सोचता हूँ मैं तुम्हारे बिन ये मौसम भी बड़ा सर्द लगता है दिल का हर एक कोना बहुत ही दर्द भरता है मेरे साए भी मुझसे अब जुदा होने को कहते हैं तुझे खोने की राहों में ये आंसू बहने लगते हैं कहाँ जाऊं कहाँ ढूंढूं मेरा वो साजो सामा तो मेरी हर एक तमन्ना तू मेरी रूह का मका तू लकीरों में नहीं था सितारों से भी पूछता है पता तेरा कहाँ होगा मगर खामोश है दुनिया कहाँ मेरा जहाँ होगा बस एक बार मुड़ के देख ले मेरी बेबसी की सूरत मुझे है आज भी तेरी वफा की सख्त जरूरत साए मेरे तन्हा सफर बस रह गया दर्द का असर साए मेरे तन्हा सफर बस रह गया दर्द का असर